Hello, this is Sue, and today I'm with Dr. Hawass, and we're going to discuss some of his expert opinion on arthritis. So Dr. Hawass, from your experience, what's your advice for patients suffering from arthritis?
My advice to patients suffering from arthritis is really you have to take care of your own health. I'm going to tell you a story of what happened to me over 18 years ago when I got involved in a car accident. That left me with back pain. I suffered from it severely for about a year and a half. Eventually, I went to see a surgeon who said, yeah, you need surgery. So I gave up and did the surgery. Unfortunately, the surgery did not help me, and I continued to suffer with chronic pain for over a decade after that. It's till I decided after 10 years to make a change in my lifestyle, look for different opinion. That's when I noticed a difference on how I treated my chronic pain. I don't want patients who are suffering from chronic arthritis to be a victim of just listening to one opinion. They need to take care of themselves by changing things at multiple magnitude or multiple directions. Yes, physio can work, chiro would work, changing a work habit would work. Like using any support function with braces would work, but none of them alone is going to work. You have to do them all in conjunction to help yourself go from one area to the other. Unfortunately, with the current system that we have, whether it's OHIP or the insurance, is limited to those systems are limited to treat acute injuries or emergencies. It's not meant for it to treat chronic illnesses, including the arthritis. So yes, the insurance and OHIP will kick in when you need a replacement surgery, but it really doesn't help you much before that phase. So in general, when we talked about that loss of function for 7 to 10 years before you qualify for that surgery, is you're losing precious time throughout your life. I advise all those patients to look for modalities to help them out. And really, if you want to invest in your health, you have to invest on it from a financial point of view too. It's just you can't wait for everything to be free before you can engage in treating yourself. Yeah, you might take supplements that can cost money. You might see a chiropractor or a physical therapist that have to be out-of-pocket money. You might revert to a procedure like PRP, and you have to pay out-of-pocket too. So if you want to wait for everything to be free, basically you're jeopardizing your health to get something free. Unless you own it and you have to be accountable for what you do, you're not going to get out of that rut. And by the time you get surgery, it's usually too late to restore your function.
You said it really well, and a lot of their lifetime that's got passed away.
Exactly. I mean, you lose precious time losing on physical activities you like to do, on hobbies that you like to do, missing out on your family, on friends, on kids, grandkids. And usually I hear from those patients is during that time, which is usually 7 to 10 years, waiting for that surgery, is basically they say they have a family, but yet they feel lonely because the family cannot engage with everything that they do. And usually what families do, they go out for gathering, but that patient is left behind because they're suffering from the arthritis. They can't walk, they can't function, so they're always put on the sidelines, and with the hope that one day I'm going to get the surgery to replace all of this. But by the time you get the surgery in 10 years or so, you've lost a lot of functionality, you lost a lot of quality time with your family, and usually irreversible. That mental damage, the depression, the anxiety, the muscle fatigue is really irreversible. So you have to take a jump, and your health is your wealth. So don't jeopardize that and act on it sooner than later.
That really makes sense. Thank you, Dr. Hawass, for sharing your point of view with us. And yeah.
Oh, you're welcome.
Thank you.
Hi, this is Mark from ArthritisVIP, Toronto's #1 provider for arthritis treatment. If you're tired of being in pain and looking for a non-surgical solution that has proven track record, then contact us at 647-540-4025 or visit us on the web, arthritisvip.com.